In this PSA, we will be focusing on biological factors of the virus that make HIV so dangerous and widespread. Let's first talk about what HIV is. The human immunodeficiency virus attacks the immune system, weakening people's defenses against numerous illnesses and cancers that healthy immune systems can battle. Infected people become immunodeficient as the virus destroys and inhibits the function of immune cells.
HIV was identified in the early 1980s. In the last 3 decades, the HIV epidemic has grown into a global crisis. From 2011 to 2020, the number of people living with HIV went from 34 million to 37 million. Where 97% of people with HIV reside in the low to middle income countries. How could these numbers have grown so drastically? Whenever a new threat enters our bodies, it is then detected by the cells in the immune system that go through a series of selective divisions, making new cells that are able to identify the threat, and then initiates the immune response. After the infection has entered, the cells remain as memory cells, now that the immune system is able to recognize and initiate its defense against the threat. But HIV has a way to counter the identification of the memory cells. The replication process of HIV has multiple genetic errors and mutations, meaning the molecules that are on the surface that would be normally recognized are different, meaning the immune system is left vulnerable to attacks from HIV because there is no memory of it being in the system. When HIV enters the immune system, HIV takes 28 days of infection to develop antibodies. Because of this, the antibodies are not a high enough level to show any signs of detection by testing. This is called the window period. Since there is no sign of HIV detected, people can go 28 days spreading the disease to multiple people, causing the disease to be dangerous to the immune system and to be easily widespread. HIV is said to be transmitted through kissing, touching, spitting, coughing, or sneezing, as well as through toilet seats, shared facilities like swimming pools, utensils, or insects. None of that is true. HIV is transmitted through activities such as sex and injection drug use. It is transmitted through bodily fluids from a person who has HIV. These fluids are blood, breast milk, semen, and vaginal fluids. HIV transmission is only possible if these fluids come in contact with the mucous membrane or damaged tissues or are directly injected into the bloodstream.
There is a lot to be gained by understanding how the body interacts with HIV. HIV is usually treated in our society as a stigmatized topic shrouded by misinformation. By better understanding the way HIV actually affects the body, we can raise awareness and destigmatize the topic. HIV is separated into 3 stages. First is acute HIV infection, second, clinical latency, and third, AIDS. Acute HIV infection is the first stage of HIV. Generally developing in 2 or 4 weeks, people tend to have a large amount of HIV in their blood, making them very contagious at this stage. Some people have flu-like symptoms such as fever, headache, and rash. In the acute stage of infection, HIV multiplies rapidly and spreads throughout the body. This stage is also called asymptomatic HIV infection or clinical latency. HIV is still active but reproduces at very low levels. Without taking HIV medicine, this period may last a decade or longer, but some may progress faster. At the end of this phase, the amount of HIV in the blood, called viral load, goes up and the CD4 or T cell count goes down. People who take HIV medicine as prescribed may never move on to stage 3, AIDS. The third and final stage for HIV is acquired immunodeficiency syndrome, or AIDS. This is the most severe phase of HIV infection. People with AIDS have very weak and severely damaged immune systems that render them vulnerable to many illnesses. People receive an AIDS diagnosis when their CD4 cell counts drops below 200 cells per cubic millimeter, which puts them at high risk for life-threatening infections. Currently, there is no cure for HIV/AIDS. Once you have the infection, your body can't get rid of it. HIV is difficult to cure because it integrates itself into the host genome of several different cell types that can hide latent in any part of the lymphoid tissues, such as lymph nodes, the liver, and the spleen. HIV therapy is currently able to take care of the virus when it does leave a cell, but if the HIV patient stops HIV therapy, the latent virus residing in the cells can come back at any time and take effect.
To prevent the spread of HIV, there are medications and other actions you can do to prevent it. Make sure to use a male or female condom, as well as informing your partner of the infection. On top of using a condom, PrEP involves taking specific HIV medication every day to reduce the risk of getting HIV.